And what about those patients that have very low levels of steroid receptors with the new ASCO-CAP guidelines with a cutoff of 1%? Do you believe that the biologic behavior of those ones that are maybe 5 or 10% ER expressing, are they the same as triple negative, or are they more like hormone receptor positive disease?
It's a great question. So there have actually been several retrospective studies that have looked at this, right? Both from a clinical perspective, clinical pathologic features, and then also from a genomic, from a tumor biology standpoint. And in fact, from a molecular point of view, they tend to be more similar to the triple negative breast cancers. There's more prevalence of basal-like tumors within the hormone receptor low HER2 negative group, and they also tend to behave in the clinical setting more similar to triple negative breast cancers.
But for clinical trials, which definition is usually used? Probably the ASCO-CAP definition for most trials.
For most trials,
speaking, right?
yes. But it brings up a very good question of whether we should be expanding that. And I think in several, there are some studies, investigator-initiated studies as well, that use a more lenient cutoff, right? That use 5 or 10% to allow those hormone receptor low HER2 negative breast cancer.